Welcome to Beyond Wealth, Success Unscripted with Matt Calnan. Discover the personal drive, professional journeys, and business strategies that have made a real impact. It's success from the inside out.
Welcome back to the show, everyone. Today we're chatting with Deb Hymers. Deb is the founder and director of NSTEP, a Made in Calgary registered charity. With over 27 years as an educator in BC and Calgary, Deb has developed and integrated wellness programs in schools, communities, and workplaces across Alberta, BC, and Ontario. Her extensive background includes curriculum development and mentorship. Deb's work with NSTEP has impacted over 77,000 children, focusing on knowledge transfer to post-secondary institutions and community organizations. So first of all, Deb, thanks for being on the show today. And do you want to start us off by telling us a little bit about yourself and what you're working on there?
Thanks, Matt, and thanks so much for inviting me to this podcast. What we're working on right now, and I'm proud to say, is we have just completed an asynchronous version of our level 1 NSTEP Eat, Walk, Live certificate, which means that we can now offer that knowledge and support virtually, in person, and now asynchronous. So anyone in the world will be able to learn why nutrition and activity build better brains and bodies. I have to tell you, Matt, learning how to do online teaching is not an easy thing to do. It was 3 years of hard work, but COVID taught us so much. There were negatives and there were positives. And what we learned is that we could be teaching one of our programs, Chef on NSTEP, virtually. Watching kids with knives, you can only look at 12 tiles on a screen until your brain just explodes. So it was a really good learning. And we learned that we could also have our content virtually for our practicum students that were all in online learning. So it just made sense that we would pursue an asynchronous version of our level 1 NSTEP Eat, Walk, Live certificate. And so snappy fingers, we just finished it on the weekend.
Oh, wow. So like perfect timing for that then.
Yeah. And then what I'll be doing tomorrow, which I love to do, is working with a group of kiddos for our Chef on NSTEP in the summertime, especially for newcomer kiddos, right, that are English language learners. And reading and math literacy skills decline in summer months or during breaks when those kiddos are not in school. So Chef is a super fun way. They're learning how to use knives, how to use other equipment. They're learning what the 3 food groups are and what another is and why activity is important, and they have fun. So we have 2 groups of students starting tomorrow, children, youth starting tomorrow, morning and afternoon, and we're using a church kitchen that is close by in the Sunalta community in Calgary. And we really believe that utilizing those facilities, those resources in communities, is a really good way that we can be taking Chef to more and more children and youth throughout Calgary this year. And I'm based in Calgary, but we have other people in Edmonton and Surrey, and I do not tell them what they need. They tell me what is happening in their community and what they need, and I don't live in Lethbridge, although I would love to have a practicum student from Lethbridge, right? That they could be the ones that become that well-respected community member to take our content.
Yeah.
Okay.
You're putting a plug out there for it. See if we can find one.
Yeah. Well, post-secondary practicum students are probably, I think, the best thing we ever did. So we have U of C, MRU, SAIT. We've had UBC and SFU in BC. We've had Grant MacEwan, U of A in Edmonton. And those young professionals, they also learn why nutrition and activity are important. And then they take that with them wherever they're going to go in their professional career. And that really is the next step for us, Matt, I was a teacher, right? But I have an undergrad degree in nutrition. I'm kind of a
Okay.
weirdo, all right? And there's nothing wrong with being different. But no one teaches teachers how about nutrition, but they're expected to teach it, right? So having our certificate program and being able to take that to undergrad, faculty of education, social work, early childhood, anyone that's going to have a professional career working with children and youth, this is
Mhm.
foundational knowledge for them. And then they will take it now and in the future to all the children and youth they work with.
Yeah. So if you were to sum up the goal of the organization in a sentence or two or a paragraph, what would that be?
The goal is knowledge transfer and support of those individuals, whether they are staff working with newcomers or their staff at the YMCA. We're a small organization,
Yeah.
but our content is what is going to help people understand why. And we bring in the neuroscience, but we simplify our messages for anyone to understand why this is so important.
Okay. Yeah, it's one of those areas when you talk about nutrition, and especially in children, I think, obviously very important, and exercise and whatnot, very important. But it is one of those areas that there is a lot of debate over a lot of times as well, right?
Oh,
And
totally.
you got people that no dairy and
Yeah,
no fats and this and this and this.
yeah,
And
yeah.
so how do you maybe synthesize all of that together to say, no, here's the program that we're moving forward with?
Well, so one of the things is, and I don't like to bring out all my show and tell pieces, but like when we look at what a healthy brain needs, right? It needs that healthy food. So we don't talk about nutrition per se. They need to be physically active, and walking is good physical activity. Being outdoors is really important, especially when you look at sleep. Um, Having water to drink, good quality sleep, and social connections. And we learned that during COVID when we were not connected. So our healthy brain poster, we added social connections in December of 2020. The other thing we do is that we will translate resources into languages that other people speak, read, or understand. So I'm
Okay.
not sure if you're fluent in Punjabi,
No, not much.
but that's what this is saying. 9 out of 10 food choices from the 3 food groups. And it's okay to have another. It's okay to have a cookie. It's okay to have a treat, because no one is going to want to join your club if you're telling them no treats allowed. Sorry.
Yeah.
And you have to run marathons. No, you do not. Walking is good activity, right? So if you talk about what are our 4 principles that guide the work we do, first of all, we simplify complex messages so that everyone can understand it. We are collaborative. We want to collaborate with other groups that have various strengths. I am not in the food distribution business, but we work with people that are with that food distribution, the food bank, Fresh Roots. We want to build leadership, student leaders, youth leaders, and we want to create a deep cultural shift that these just become habits that you do every day. And that will create an intergenerational change so that when children learn, practice, and apply these healthy habits, they will take them into adulthood and they will transfer that knowledge to their children. And unfortunately, Matt, there's tons of others in grocery stores, right? And people believe that healthy food is expensive. It doesn't have to be
Mhm.
expensive. But if you don't have the skills of how to prepare food, then, we know all those providers that will deliver it to your door, and you have no idea what they put into it, right? But we all need to eat to live, and we want to live a long and healthy life. So I now
Yeah.
say, I used to just be focused on ages 6 to 12. I now say really NSTEP is from 0 to 90. The things that you learn at an early age, you need to repeat them all through your life. And then that will reduce the amount of money on treating of chronic disease, 80% of which is preventable.
Yeah. Yeah. Yeah, that's always interesting when you look at programs like this, because obviously there's a lag to that
Yeah,
benefit. But from a government standpoint, especially in a system like ours, where it's it's public health care, that investment now shows up in 10 years, 20 years, 30 years, and
20.
even sooner in a lot of cases, right?
Yeah,
On people that are really making a change. That's generally if they're older and
yeah,
doing that, I think, but it does show up for them.
it does. And how do you measure you prevented chronic disease? You can easily measure how many hips you replace, right? But
Yeah.
people always say, how do you measure? Well, now we've been invited to be part of a global chronic disease prevention research project. So, true secret, Matt, okay. I had my birthday in July, I turned 72. Research projects are 5 years minimum.
Yeah.
So I'm not sure it's 77 that's what I'm going to be doing, but I probably will still be doing that because I'm passionate about children and youth just having the best opportunities they can for the rest of their lives.
Yeah. What got you into this? What's the motivator behind it?
Okay, so as you talked about, I was a teacher for 27 years. I finished my MBA, and the World Health Organization came out and said, this is the first generation of children that will die before their parents due to preventable nutritional diseases. And that was in 2002.
Yeah.
2002, right? So I was teaching grade 9 science, trying to inspire my students to love science. But I thought, what if their food and activity choices were poor? It would diminish the quality of their lives as they got older. So I decided I could do something. Just me, right? I took a leave of absence. I would have made a lot more money. I would have had a bigger pension if I kept doing what I love doing, but
Yeah.
I could only impact in a year 180 kids.
Yeah.
Since 2010, with a team of incredible people, we've impacted over 77,000 kids. To think how many years I'd have to be teaching myself,
Yeah.
that would be in the 300 plus years.
Yeah.
We don't have time for that, right? And so that's what motivated me was I thought I can do something. And someone said, well, why you? And I went, well, if not me, then who? Who?
Yeah. Yeah, exactly. Yeah, and it only takes one person sometimes, right, to create those programs and get the momentum going. And then you hope that you develop the team and you get other people on board that continue that momentum. But yeah, it does only have to be one person to
Yeah,
start a trend like that.
yeah, exactly.
So did you say, I think you kind of mentioned there, I was going to ask you how long you've been doing this for. Was that 2010?
Oh, so I took a leave in 2002, right?
Okay.
So I've been doing this since 2002, but in 2009, I recognized there's something wrong the way we're implementing it. And that's because, I mean, I was a teacher. I knew a guest is coming in. That means marking time for me. Okay, I can mark, right? You have this pile of doom that is sitting there for you.
Yeah. Yeah.
So I thought about how can I make this so there's a knowledge transfer for teachers. I'm going to create a professional development model where we are doing the professional development for the teachers in the school. And then they are going to take that knowledge with them. And then we're going to provide classroom follow-ups for them. And it worked. Teachers understood what it was. Now we've tried to do a different implementation this year, but because there's new curriculum in Alberta, we are really going to focus the next couple of years on just on Chef on InStep. It is the secret sauce. It is what kids love to do. It's what parents love to do with their children, right? So Chef on InStep still has all of that education component in it, but they're also learning food literacy skills, which are really, really important.
Can you maybe dive into that a little bit? And I think that was the asynchronous certification and whatnot that you're talking about was that Chef on InStep. Can you go into a little bit more about what you're doing with that?
So really, obesity, and I don't like to talk about excess weight, okay? It's the chronic diseases associated with that excess weight is a worldwide problem. It's not a Canadian problem. It is something that affects every single country. So, and they're all in different time zones. So creating an asynchronous version of our content means that you could be in a different time zone. And what I really want to do, Matt, is I want to find well-respected community members in other countries that we can have them take our certificate, and then we support them. But they will be the ones that take it into their community because they are the well-respected community member. And I think about, I'm going to give an example of one of my practicum students, Isha Gill. Isha Gill was a 2019 practicum student at U of C. A well-respected Sikh community member here in Calgary. And she was the one that introduced us to the Dashmish Cultural Center, that introduced us to Kelsa School. So finding those well-respected community members and then have them have the passion of why nutrition and activity. She just finished doing her Master's of Public Health out at UBC and is still an instepper, right?
Yeah.
Lakin Ajubulu, practicum student 2021, immigrated from Nigeria, and he really became passionate about nutrition and activity. He's now in the Faculty of Medicine at U of A.
Okay.
Lakin, I want you to take InStep with you into the Faculty of Medicine. So that's why those young professionals are a really good way for that knowledge transfer and support, and also a bigger ripple effect exponentially that they will impact more children and youth.
Yeah. Yeah. And how are you finding those individuals, those practicum students?
So they apply to us.
Okay.
Right? So MRU through physical literacy, U of C through kinesiology, we've had nursing practicum students, right? None of them have that integration of nutrition, activity, neuroscience, growth mindset, executive function, all of that deep understanding. So it becomes an asset for them for when they're working with clients, patients, right? Understanding the relationship in our brain between the amygdala, the hippocampus, and the prefrontal cortex. And once you understand the amygdala is the one in control, it makes a whole bunch of difference of how you interact with people.
Interesting. Can you maybe dive into that a little bit further? I mean, you probably know a lot more about the science than somebody like me is ever going to understand. But why is that? And what do you need to do then for that?
Okay, here you go. So think about your thumb being your amygdala, okay?
Okay.
Hippocampus is close by. And then when you roll your hand over top, okay, your fingernails, the depth, the surface area represent your prefrontal cortex, which is right here. Your prefrontal cortex is your executive function. It's the decision-making, blah, blah, blah. Your amygdala is your emotional switching station. If you are frightened, you go into fight, flight, or freeze, and there's no learning going on, okay? Your hippocampus is near your amygdala, and that is where memories, long-term memory is stored. It is also how you make a map of 360 degrees of how much room your body takes up in space. So people that are not moving or haven't quite figured that out, they're kind of clumsy, right? And they just need to be moving more. So something that is frightening for a child, their amygdala will be on fire and they're in fight, flight, or freeze. And you have to get them calmed down so that real learning can take place. So I think understanding that, and that comes from a book called Neuroteach. I'll send you a list of reading, okay, Matt?
Yeah, for sure. Yeah.
And our research on activity comes from Dr. John Rate. So we use scientific evidence-based research for all of our content, and then we simplify it. So you don't need a biochemistry degree to understand what we're saying.
Okay.
But,
Well, that's good because I don't have one of those. So that's a good thing.
But the nutrition part really does go into brain function as well, but I'll leave that. Okay. I won't get you. We'll find another time to chat. Okay.
So what about say I'm a parent, I've got a 6-year-old daughter and a 4-year-old son. Um, what do we need to be doing with our kids, or what resources are available out there to really learn this and understand it more?
So, well, I would tell you to come and to take our certificate program, right?
Yeah.
But the other thing is there are lots of really excellent resources out there. And one of the ones that we really love, you said you had a 4 and 6-year-old,
Yeah.
is Active for Life. And Active for Life is really about promoting physical literacy, fundamental movement skills. And these don't have to be expensive or anything like that. During COVID, we would send activities home like sock box, which is their idea. You just take different boxes, different sizes, you roll up a ball of socks, and it becomes a ball that they're trying to practice to get in to the box, right? So building those fundamental movement skills is critical for those kiddos. So Active for Life is an excellent resource. And go to our website. We have lots of resources there for parents. And then we also would love to have parents reach out. They have a group of 10 parents that are interested in learning. Cook with your kids at home, right? Take them to the grocery store and have them pick out a new vegetable or fruit.
Yeah.
Because half of our plate should be vegetables and fruit. And fruit is much easier to eat because it's naturally sweet. But you need to have a variety of foods from the 3 food groups, and it's okay to have another. So preparing food, because monkeys see, monkey do. So they're watching you. And so just be engaged with them about, okay, well, let's learn how to tear up lettuce and do sandwich on a stick, which is a super fun recipe that I'll send to you, Matt, to do with your 4 and 6-year-old.
Yeah, please do. Yeah. Awesome. What's next for you guys then? Like what are you looking for, whether that's yourself, the organization, over the next little while?
Funding, because it's the
Mhm.
economy, right?
Yeah.
And I'm sure when you talk for any business, whether it's a registered charity or for profit, if you do not cover your costs, you go under.
Yes.
So,
Yes.
we're always looking for funding. We now have program revenue where we charge a nominal fee for our certificate program for the 6 hours. And we're always looking for different groups that are interested. So a special education teacher reached out to me this summer from Montreal. And she was really interested in nutrition and somehow found our website. She wants us to take NSTEP to Quebec. I'm going, well, let's have a conversation. So we're having a conversation with her on Friday. So again, you just never know who is going to find out what NSTEP is and what we're about. So I really appreciate you taking the time to find out what we're about, because we really do want to collaborate with other organizations that have different strengths.
Yeah. Yeah, no, and I think for any parent, I think nutrition is always at the top of your mind. I think especially with parents with younger kids, because they
Yeah.
tend to be a little bit pickier
Yeah.
in what they're in, a little bit more of a challenge. So I think that's always on the top of, people like me. It's always on the top of our mind. So I think having those resources and getting that knowledge out there is always going to be an important thing.
It is. And I'm going to give you something to do tonight with your kids. You're
Okay.
going to take a grape tomato and a
Okay.
piece of carrot, and you're going to say, I wonder if the carrot goes crunch or squish. And they're going to try it, and it's going to go crunch. And I
Yeah.
wonder if the grape tomato is going to go crunch or squish. So when we make it a game, it's always fun. And we want you are the opportunist right now to build an adventuresome eater. So your kids are going to love to try different foods, right? And sometimes you have to try 25 times, right?
Yeah.
For them to try, and finally they will start to like it. So don't give up trying, but playing squish or crunch is a fun way to introduce some vegetables and fruit.
I will give that a shot. I'll give it a shot tonight and I'll let you know how it goes.
Okay, good, Matt.
If somebody wanted to learn more about the program or learn more about yourself or connect with you, where would they go for that?
I'm going to send them to our website, www.nstep.ca. NSTEP.ca. And you asked, how did that get started? N is for nutrition, S is for students, T is for teachers, E is for exercise, P is for parents, but we really are about school and community because that's where children live, learn, and play.
That's awesome. Well, thank you so much for your time today, Deb. It was a pleasure having you on here, and we certainly wish you the best of luck moving forward.
Thank you so much, Matt. All the best to you and your kiddos too.
Thanks.
You've been listening to Beyond Wealth, Success Unscripted with Matt Calnan. Want to be our next guest? Visit beyondwealthpodcast.ca/guest. See you on the next episode.